Assalamu alaikum. Welcome back from the ad break. You are still watching Prime Live. Up next, I have a fantastic interview with Dr. Rushdah Khan, and we will be talking about, World Cervical Cancer Day, which was on the 17th of November. Now, Dr. Rushdah Khan is a dedicated gynecologist, and she will be discussing with us the significance of World Cervical Cancer Day, observed, like we mentioned, on the 17th of November. Now, she'll also be shedding light on cervical cancer prevention, early detection, and treatment options, emphasizing the importance of raising awareness to save lives and eliminate the preventable disease. Thank you so much for joining us, Dr. Rushdah, and welcome to Prime Live.
Assalamu alaikum. Thank you for having me.
You are welcome. Now, can you just tell us exactly what are the common causes and risk factors for cervical cancer?
So cervical cancer is the commonest cause of cancer death in South African women, and the 95% of cervical cancer is caused by human papillomavirus. It's an extremely common virus. The highest risk forms are HPV, so human papillomavirus 16 and 18, and that is the primary cause. Then risk factors, most importantly, are HPV infection, especially with a high-risk subtype, and then smoking is another cause. And there are various other causes which include a very early sexual debut, multiple sexual partners, and there are other smaller risk factors, but those are the main ones.
And if you can just take us through exactly what cervical cancer is, like what's actually happening in your body.
Okay, so there's a special, so your cervix is it's the mouth of your uterus. And it's the same cervix that would dilate, as most people know when you have a baby. So to give people a visual of what we're talking about.
Yeah.
So there are vulnerable cells in that area that when exposed to a human papilloma virus, it gets in there, and over a period of time, and which is anything between 10 to 15 years. And in people with low immune systems, it can be earlier than that, within 5 years, 5 to 10 years. Over time, it can change. So there are precancerous lesions that then can eventually become cervical cancer, which is an easily preventable. It's one of the most preventable forms of cancer if picked up early. But if it progresses, it causes a high rate of mortality and morbidity, which is sickness and death amongst women.
And let's talk about the common symptoms for cervical cancer, and also how it can be diagnosed.
So the common symptoms are, unfortunately, that there are in early stages no symptoms, which is the scary part, which is why screening is so important. So I'll go into a bit about screening just now, but in terms of symptomatology, in fact, when you're feeling symptoms, you are already on a more advanced stage of cancer. Some of those symptoms can be stuff like abnormal bleeding, post-coital bleeding, bleeding in between your periods, having a foul-smelling discharge that you can't explain, persistent, which goes on persistently, and then sometimes it's pelvic pain or pain during intercourse. So those, sometimes it's also just backache. So those are some of the symptoms that would get a patient to come and see us.
And also pap smears are crucial tool in cervical cancer screening. Can you maybe explain to us the procedure, the importance, and also how often should women go for a pap smear?
Okay, so pap smears are absolutely crucial. It's a 5-minute procedure. It can be done. I think people have the misunderstanding that you have to see a gynecologist to do a pap smear, which is one of the messages I'd like, and I also tell my patients this, is that pap smears are available at primary healthcare clinics. Pap smears are available at your general practitioner. There are also nurses in places like clinics that can do a pap smear. It's a 5-minute procedure. We put in a speculum. So most of us use a metal speculum, which just stretches open the vagina. We take a brush. It's, I would say, discomfort, not pain, when we're doing the procedure. You take the brush and you collect some cells from the mouth of the uterus, and you send them off for testing. And in terms of when you should do a pap smear, so our South African guidelines have historically started pap smears at the age of 30 in low-risk women. Low-risk women meaning women who have no risk factors. Who have no risk factors, such as having being a women living with HIV or other immune compromising medical conditions. So age of 30, 3 pap smears at 30, 40, and 50. And historically, they've been cytology, which is looking for cells instead of looking for HPV. Then in high-risk women, for example, in our country, important risk factor would be HIV. That would be from diagnosis of HIV. And then if no abnormality is found, it would be 3 yearly pap smears. If an abnormality was found, then depending on the abnormality, one would repeat the pap smear yearly go on to doing other investigations such as colposcopy, which is where we look at the cervix under a microscope. But the newer guidelines are moving towards doing HPV testing instead. In fact, in the private sector, where cost hasn't been as much of a consideration as in public, because a lot of the medical aids for a few years now have been paying for HPV testing. So HPV testing we use liquid-based medium. We do the same thing with the brush. We put it in a bottle, and we actually look for HPV. And if the HPV is present, then they go on to do a cytology test. Thankfully, the government is also moving towards doing this in the public sector. Some of the provinces have started doing it. And we've even, an exciting thing that has not been around for a very long time is HPV self-testing, which is great because it's actually just like an earbud that you can do yourself. And especially with women who, it makes it more accessible to women. And the only problem with the self-testing is if it comes back positive, you do need to go for a formal pap smear to do the cytology.
And let's talk about the accuracy of pap smears in detecting, cervical abnormalities, and what happens if results show any irregularities.
So the cytology testing is less sensitive meaning in picking up a problem than the HPV testing. That's why we're moving towards the HPV testing. It's fairly accurate. The problem is that it's just a screening test. Okay, if it were to come back with an abnormality, we would need to go on to be to look, which is the colposcopy.
And besides cervical cancer, what else does pap smear help with?
What else does pap smear help with?
Yes.
Okay, so with the new liquid-based medium, we do get things like in the report that says you might have candida, which is like a yeast infection, etc. But in a woman who's not symptomatic for that, we don't tend to treat it. So it is primarily used for cervical cancer screening.
And can you tell us what treatment options are available for cervical cancer and how effective are they?
Okay, so I think it's important for me to just mention the precancerous lesions also, because especially as in the general population, that's what we're looking for when we're doing a pap smear. If it happens to say that it might be something more serious, then we would go on to do biopsies in theater, right, or a large loop excision. But the treatment for finding an abnormality on the pap smear, especially if it's HPV 16 and 18, is to do a colposcopy. There are centers and gynecologists who do colposcopies in their rooms, but that needs specialized equipment. A lot of us do it in theater for pain control, etc., especially when it is that we're going to, depending on what we see, because we look for certain criteria, is that we use, it's called a large loop excision, where you'd remove the part of the cervix that shows an abnormality under a microscope, which is basically what a colposcopy is. With regards to cervical cancer, if you find it early, which is stage 1, then most often it is a hysterectomy, a radical hysterectomy. I myself, in my practice, would refer that onto a gynecologist because it's a specialized surgery. Right? If it was stage 2 or stage 3, it often requires radiation and chemotherapy. And it's usually done in a multidisciplinary team with the gynecologist, the radiation oncologist, the medical oncologist. And those are the treatments that are available in the medical treatment.
And let's talk about the importance of promoting cervical cancer screening and awareness, especially for underserved communities.
So very important, and unfortunately very underserved in terms of location, in terms of socioeconomic status. And I mean, historically, the missed cervical cancers are often in women who haven't had access to pap smears. Unfortunately, there's also a lot of fear in communities that haven't been educated about this. So definitely, there are a few strategies, and one of them is mobile clinics. The cancer has some mobile clinics. That is one of the routes to be able to access, the outlying communities. But also, importantly, I think is education. I think education is the biggest and most important part, to actually get community leaders and people that people in the communities trust. So traditional healers, priests, pastors, who and educate them to also bring the communities to do the testing. Pap smears are available through these mobile clinics, through primary health care. We need to also start incorporating, which are strategies that are being used into incorporating pap smears as part of and women who've had babies, who would come to a clinic for that reason, women who come for HIV treatment, people who come to their normal local primary healthcare clinics, that you do opportunistic, healthcare education and then pap smears. And then also with regards to the more specialized things, which is colposcopy, we need to, there aren't enough centers that do that. And so there are other forms of it that are done in the periphery with guidelines on when to refer to a tertiary institute. So like in Johannesburg, places that have colposcopy clinics are Chris Hani Baragwanath. I'm talking about the public sector, as well as Charlotte Maxeke Hospital and Rahima Musa. So those are the places that we refer to from the public clinics.
And, can we talk also about how cervical cancer also affects a woman's reproductive health and quality of life?
So it comes with a lot of stigma, and one of the things I want to say is having HPV and having cervical cancer is no measure of promiscuity, which is a misunderstanding that I find to be quite common in the general population. So that's the first thing. It definitely affects relationships, especially with a lack of education. It affects families, it affects communities. Women form a very important part in our country of the informal economy, and so definitely children are affected financially, families are affected financially. And in terms of the reproductive aspect, one can only potentially preserve fertility if it's picked up extremely early and in the hands of gyne-oncologists who can do specialized surgery to try and to keep the uterus. And then there's also because we live in an era of fertility medicine, there are other options such as preserving, ovary, ovum, and getting surrogates and that kind of thing. But all these things are very costly. So definitely your fertility can be very badly affected if you come with if you get the diagnosis of cervical cancer. But say also precancerous lesions that need us to cut, do the loop excision, that can also increase your chance of having preterm labor when you do have a baby, especially if you need the procedure more than once, and depending on how much was cut. So these are all things that we counsel our patients on before we do the surgery.
And can we also talk about, support systems that are available for, cervical cancer patients and also survivors?
Okay. I'm very happy to say that in the centers that do run oncology services, such as Baragwanath, such as Charlotte Maxeke, there are psychologists involved. Some of the hospitals do have group like support groups. Also in certain communities, and it's something that we should actually promote more of, there are community support groups. But I think changing the mindset towards the initial cause is very important, so that these support systems are also there in the home, which is not always the case. So bringing your partner with, like partners being present throughout the journey of cervical cancer is very important, so that you have the opportunity to educate them as well. And those support systems are also available. And then there are palliative, so it depends on what type of support. There are also palliative care. That's when, end of life care, end of life support that the our medical facilities do offer. And then the other thing is associations like cancer also have support options. Yeah.
I mean, Dr. Rushdah, this has been such an insightful conversation. Thank you so much for sharing with us your knowledge and making sure that we raise awareness around this important topic.
Thank you.
You're
Thank you for
welcome.
having me.
You're welcome. Visit home. This was Dr. Rushdah Khan, who is a dedicated gynecologist, and we were just discussing the significance of World Cervical Cancer Day that was observed on the 17th of November. But on that note, viewers at home, it's time for us to head over to a quick break. We'll see you right after this.